Suicide is one of the leading causes of death for young people. 1 in 6 young people have experienced a major depressive episode. If this is the case, why isn't mental health an important factor for overall well-being, especially in children and adolescents? Before we get into this daunting question, let's talk a little bit about what mental health is and what mental illness can look like. According to mentalhealth.gov, mental health includes our emotional, psychological, and social well-being. It can affect how we think, feel, and act. The major contributors to mental illness are biological factors such as genes and brain chemistry, life experiences including trauma and abuse, and family histories with mental illness. Speaking from my own experience with trauma that resulted in anxiety starting at a young age, carrying these mental health issues with me has not been an easy feat, especially through college. According to the American Psychological Association, during the 2020-2021 school year, 60% of college students met the criteria for at least one mental health problem, according to a study which collected data from 373 campuses across the country. This has been an issue for college students way before the pandemic, but it's only continuing to get worse. Sarah K. Lipson, a Boston University assistant professor of health law, policy, and management, said that 75% of lifetime mental health problems will onset by age 24. With all of this research on mental health of college students and young people, you'd think there'd be more resources out there for those in need. Unfortunately, you'd be wrong. Remember that data that I referred to in the beginning of the video? That data came from a research organization called the Healthy Minds Network. The Healthy Minds Network is an organization dedicated to improving the mental and emotional well-being of adolescents and young adults. The Healthy Minds Network collected data from the school year 2021 to 2022 from 373 campuses nationwide and found that 40% of those that participated in the survey had some form of depression, 37% had anxiety disorder, 47% had a lifetime diagnosis of a mental disorder, and arguably one of the most heartbreaking pieces of data, 40% agreed with the statement, most people would think less of someone who has received mental health treatment. Well, why is that? Next, let's talk about the stigmas and stereotypes linked to mental health. Some common misconceptions you may have heard about mentally ill individuals is that they are crazy, dangerous, and deranged. Some people can even face backlash for seeking help for their mental illness. They can sometimes be seen as weak or less than. This could stem from the barbaric and abusive treatment conditions for the mentally ill starting back in the 17th century. Individuals during that time could be thrown into asylums for even simply being homosexual. According to Everyday Health, the institutions were places people with mental disorders could be placed allegedly for treatment, but also often to remove them from the view of their families and communities. Having a non-socially acceptable trait that is often criticized and stigmatized is unfortunately not a thing of the past. Like any other stigma, it is born from ignorance and misunderstanding, which is why it is important to educate yourself before placing your opinions on another person's potential well-being. Now that we've talked a bit about the stereotypes and stigmas, let's talk about who is most prone to mental illness. According to Johns Hopkins Medicine, young people, especially young women, are twice as likely than men to suffer from major depression, but they are equally as likely to suffer from bipolar disorder. Those with depression and bipolar are typically diagnosed and the symptoms are present in the early 20s. Anxiety disorders such as PTSD, OCD, panic disorder, and the like also tend to emerge during late adolescence or early adulthood. With that, women are more likely to attempt suicide, but men are 4 times as likely to succeed at it. Unfortunately, the demographics don't just stop there. According to the blog activeminds.org, people of color, the LGBTQ+ community, and people with disabilities are less likely to seek help for their mental health concerns, and when they do, they are less likely to receive appropriate care. This may be due to a variety of factors, including systemic racism, discrimination, lack of cultural competence among providers, and lack of access to those services in those types of communities. And arguably, one of the most heartbreaking fact of it all, suicide is one of the leading causes of death in adolescents and adults 15 to 24 years of age. With all of that being said, again, why aren't we as a society making it a point to raise awareness for mental health and illnesses, especially in public schools and colleges, and making sure our minds of the future have the resources they need to feel safe and secure? Well, that could be that some parents across the country are protesting against the social-emotional learning in public schools. According to an article written by Shirin Ali on TheHill.com, some parents believe the topics of suicide and depression are topics they don't believe affect young students. Judging by the massive amounts of studies, statistics, and data that have been taken on this exact subject, those parents may want to take a closer look. Now that we know a bit about the basics of mental health and who is most prone to mental illness, let's dive into factors that contribute to the accessibility of mental health services. A comprehensive study called the America's Mental Health 2018 is a study conducted by the Cohen Veteran Network and the National Council for Behavioral Health to gain a better understanding of our country's access to mental health services and our attitudes towards it. The data was taken from a sample of 5,000 Americans representative of the population. They based accessibility on 4 factors: providers, facilities, funding, and satisfaction. The data from the study is disappointing but not surprising. The study found that the demand for mental health services are higher than ever, with nearly 56% of Americans currently seeking either for themselves or a loved one. These individuals were mostly younger with lower income or a military background. According to the National Council for Mental Well-Being, despite the strong demand and growing societal awareness of the importance of mental health in the United States, the study revealed that the overwhelming majority of Americans, 74%, do not believe such services are accessible for everyone, and about half, 47%, believe options are limited. When it comes to accessibility, 42% of participants in the study saw cost and poor insurance coverage as the top barriers for accessing mental health care. 1 in 4 Americans even reported having to choose between mental health treatment and daily necessities. Limited options and long waits are also one of the top reported barriers to accessibility. 38% of the participants reported having to wait over a week for mental health treatments, and nearly half of them, at 46%, reported having or knowing someone who has had to drive more than an hour round trip to receive treatment. Lack of awareness is also a significant barrier to accessibility. According to the National Council for Mental Well-Being, while most Americans do try to seek out treatment, there is also a large portion of the population who have wanted to but did not seek treatment for themselves or loved ones, 29%, in part due to not knowing where to go if they needed this service. The last barrier we will look at that contributes to the accessibility of mental health services found in this study is social stigma. Nearly 1/3 of participants reported having worried about others judging them for seeking out mental health services, and about 1/5 even reported lying about receiving mental health services, and it was more truer for the younger participants. Although this is just a quick rundown of the study from 2018, you can find a more in-depth and comprehensive snapshot of the study at mhanational.org, which also includes a ranking of accessibility by state. Now that we know the basics of mental health, its stigmas, who is most prone to it, and the accessibility to mental health services, let's explore what legislation is doing to improve the mental health crisis in America. The Lower Healthcare Costs Act was introduced in 2019, and it aims to improve transparency in healthcare contracting and pricing, reduce surprise medical billing, and lower the price of prescription drugs. The claim to say that it is working is debatable. There's also the Mental Health Parity Compliance Act, which was first introduced in 2008 and revised in 2019. The Mental Health Parity Compliance Act, according to the Substance Abuse and Mental Health Services Administration, requires most health plans or health insurers that offer coverage for mental health conditions or substance use disorders to make these benefits comparable to those offered for medical and surgical benefits. This means that deductibles, copays, out-of-pocket maximums, and treatment limitations for mental health or substance use disorders must not be more restrictive than corresponding requirements or parameters offered for medical and surgical benefits. This act aims at individuals making more informed decisions regarding their mental health care. The next bill we will discuss is the Mental Health Services for Students Act. The Mental Health Services for Students Act aims to give more comprehensive and effective mental health care in schools through grant funding. According to the American Association of Child and Adolescent Psychiatry, the funds help schools partner with community health professionals to provide on-site mental and behavioral health services, provide professional development to help recognize early indicators of mental or behavioral health issues, help local communities develop policies to assist students with their mental health needs, and lastly, establish mechanisms to report violence. The last piece of legislation we will explore is the Rise Against Trauma Act. RISE standing for Resilience, Investment, Support, and Expansion. The Rise Against Trauma Act aims to expand the trauma-informed workforce in schools, healthcare settings, social services, first responders, and the justice system. This increases support for children exposed to adverse childhood experiences and trauma through increased funding for our community-based efforts. For a more in-depth look at our current legislation regarding mental health in America, visit mhanational.org. Although it seems like mental health awareness is becoming a movement and is being more focused on, we still have a very long way to go. The COVID-19 pandemic, constant mass shootings, and political turmoil certainly hasn't helped, and I believe it has launched us further into our nation's mental health crisis. As Martin Luther King Jr. once said, "Of all the forms of inequality, injustice in health is the most shocking and inhumane." Mental health services should be available and accessible to all people, all of the time, and I believe mental health awareness, checks, services, etc. should be prioritized from early infancy the same way physical health is. If you or a loved one are struggling with your mental health or a substance use disorder, you can call the Behavioral Health Helpline at 833-773-2445 for immediate help, or you can also dial 988 at any time for the National Suicide Prevention Hotline. My name is Trinity, and thank you for watching my video essay on the mental health crisis in America.